And it is important for you to know that Pakistan is one of only 23 countries that have developed a national surgical obstetric anesthesia plan. So you can be proud of that, but like all plans, it can sit on the shelf and do nothing. So it has to be implemented. So we've been pleased to work yesterday with some of your policymakers and politicians to discuss the barriers to the implementation of that. I'd like you to think about the fact that 1 in every 3 people in the world, 1 in 3 Pakistan people, will need some form of surgery, obstetric, trauma and anaesthesia care, possibly within the next 12 months. And so that is what our organisation is about, advocating to make access to that care a reality, so that when they have, for example, a head injury, which we have also discussed, firstly, we can prevent it by wearing helmets. So we've been discussing that situation. But secondly, when it occurs, that they can get access to good, safe treatment. People, not just in urban centres like Peshawar, but people in rural areas as well. I work in the Democratic Republic of Congo. That's a conflict zone, so I understand also the conflicts and other problems that can occur. And for people who live in poverty, who have no access, it is a huge problem. So I personally have finished my practice in Australia so that I could work in an area like that to improve the lot of the poor and the marginalised gaining surgery, obstetric, trauma and anaesthesia care. But that is why I am committed to this organisation, because we work from the bottom up, which is what I am doing in Congo, and the top down by advocating to multilateral bodies like WHO, UN, and governments, individual ministries of health, to bring better access for the 1 in 3 people who will need some form of surgery, trauma and anaesthesia, or obstetric care in particular.
Grateful for the warm welcome we've received from Pakistan and its people, and the lessons learned from your public health policies, and advocating for better health for every one of the people that resides, particularly as mentioned with the discussion with policymakers, bringing together frontline workers, patient advocates, policymakers, professors, everybody who has or can be relevant to healthcare into one room to see how we can change the world and improve healthcare systems, starting locally here in KP, and bringing those lessons globally to all the communities that we work in. I work in Tanzania as a neurosurgeon, and am incredibly grateful to learn from the process that you have gone through here to bring those lessons back to the group that we work with there, for example. The other part is supporting all the allies that are incredibly important to these efforts, like the nursing body that takes care of all of our patients, and the next leaders of tomorrow, the students that have been involved in these efforts, not only here in Pakistan, but globally, are inspiring to us, and they will be the ones leading the charge to bring better health care to the neglected surgical patient. So we thank you for your warm welcome.
Pleasure to hold our 16th annual meeting of the Permanent Council of the G4 Alliance here in Peshawar. This is not my first time. In fact, it's my 3rd time in Pakistan, and I trust that it won't be my last. Pakistan has been a very important partner in our global efforts, and in particular, Northwest Hospital here in Peshawar is one of the leaders of the work that we are trying to do, that to say simply, we are trying to bring access to quality, affordable surgical care to everyone, everywhere. And through our work as individual organizations, and our group represents nearly 80 member organizations, We work together with one another to increase access to care, surgical care around the world. And we also work with the large multilateral organizations that are intended to be directing and helping with these efforts. Organizations like the World Health Organization, the UN General Assembly, and the World Bank. We also work with individual ministries of health in order to help them raise access to surgical care that is quality, timely, affordable for everyone everywhere. Why do we care so much about this? Because we know with our data-driven advocacy, we have known for 10 years that 5 billion of the 8 billion people on this planet do not have access to even emergency or essential surgical care. So as representatives of the surgical community, we are accepting this responsibility, not only to provide direct care, as we all do as doctors and nurses, but also to advocate on behalf of patients everywhere for large organizations to help with health system strengthening so that everyone can have access to this care that they deserve. Thank you.
Surgical care and surgical access. Yesterday, we had our roundtable meeting and we got to hear from experts from all over the KP province and Pakistan. And it feels like you were very, very close to being able to implement the very good plan that you've already developed.